Hello, my name is Mike Wiese, and I am the Epidemiology Program Manager for the Florida Department of Health in Hillsborough County. I am going to talk to you today about a project titled Hindsight is 2020, Lessons Learned for Health Departments Hiring Epidemic Response Contact Tracers. A huge shout out to my co-authors on the project, Laura Rusnak, Dr. Alison Oberne, Patrick Rodriguez, and Dr. Makut. This team is all with the University of South Florida in the College of Public Health there, and they were really all amazing to work with, so really a huge thank you, and couldn't have done this without any of them. So jumping right in with a little bit of background that led to our research. Hillsborough County is the fourth largest county in the state of Florida with a population of about 1.5 million people. We do encompass the city of Tampa. Within the health department, the Hillsborough County Epidemiology program is the one that coordinates and is responsible for infectious disease investigations. So was therefore the program that was tasked with the coordination of the COVID-19 surveillance, case investigations, outbreaks, contact tracing, really everything associated with the COVID-19 case contact tracing effort. Normally, our epidemiology program consists of just 11 full-time epidemiologists and supporting staff. So DOH-Hillsborough, much like every other county and state during the pandemic, was confronted with the major problem of needing far more staff than we had to meet the very quickly increasing workload that was associated with COVID-19 contact tracing. So over the course of the next year, the Department of Health in Hillsborough ended up utilizing a variety of avenues to pursue different staff for contact tracing. This included reassigning internal staff that were part of other Hillsborough County programs, but were then switched to the EPI program for contact tracing. We also hired faculty and students through university partnerships. We also used third-party hiring agencies to hire contracted staff. And then we also did hiring at both the state and county level. So our team really faced the challenge of hiring, training, and then supervising all of these contact tracers, and all very quickly. So our research team really explored the workload and the employee effectiveness among the different staffing groups hired during the COVID-19 pandemic in order to promote improved workforce response in future events. So our methods to do this included assessing both the efficiency and effectiveness of different staffing groups that we hired between March 1st of 2020 and January 31st of 2021. We performed quantitative analysis of our HR data out of the state timekeeping database, and also from the statewide reportable disease database, that's Merlin. And we compared workload and work time across staffing groups and looked at work output. And then we also did qualitative interviews with the core epidemiology staff to further explore their effort and the ability across the different staffing groups. So here is a figure representing some of our quantitative data. The horizontal bars of each color represent different staffing groups, and the placement and length of each bar is based on when they began and also when they ended. This is kind of arranged so you can really just see the progression of the different staffing groups over time. The orange is our core epidemiology staff, and they of course were in place even well before this study period began on March 1st. And they went all the way through the end of this study period as well. The green line is our state level hires that were hired at the state level. The teal line is our reassigned staff. So that was the Department of Health Hillsborough staff from other programs that were then moved into the epidemiology program for contact tracing. The yellow indicate the faculty and students that were hired through university partnerships. The dark blue is our contact tracing staff hired through the hiring agency, the contracted staff. And then the red bar is hires that were hired internally at the Department of Health, Hillsborough. Then, on top of this, we indicate a black line that represents the 7-day moving average of the total cases and contacts over the course of the study period. And this is kind of meant to represent the overall workload over the course of time. You can really see that there were peaks in the workload in the summer of 2020, where we were doing about 1,000 cases and contacts per day. And then again in the winter of 2020, right into the beginning of 2021, where cases peaked close to 1,300 cases a day, cases and contacts a day. Well, the core epidemiology staff was in place at the start of the analysis period. The first additional staffing was the internal staff that were reassigned. Then the other thing I want to point out is that contracted staff in the blue color were, of course, the shortest in duration, and that the 3 staffing groups that I have indicated here, the core epidemiology staff, the state level hires, and the DOH-Hillsborough, the local level hires, were the staffing groups that continued even beyond this analysis period. So they were working all the way through this period. Moving into our table 1 here, you can see some of the key metrics associated with the different staffing groups. First off, you can see that during the study period, we had a total of 199 staff that worked over 132,000 hours on COVID response. Over this period, we also identified 108,068 COVID-19 cases and 53,539 contacts. So that was a total work volume of 161,607 cases and contacts that were worked during the study period. So as an estimate of kind of the work productivity, we calculated the number of hours per COVID-19 case or contact for each of the staffing groups. This was done by dividing the total COVID-19 work hours by the total cases and contacts that were performed by that staffing group. You can see here I've highlighted kind of the range, which goes from a low, which is kind of the most efficient, where our university partners at 0.67 hours per case or contact, and also right behind them were the contracted staff at 0.18 hours per contact. Then at the other end, taking the most time per case or contact at 10.16 hours were the core epidemiology staff. Then I've also highlighted that we calculated the percentage of cases that each case was able to interview. University partners interviewed the lowest percentage at 48.85%, and our reassigned staff were the highest at about 75.9%. Moving into the qualitative results, interviews were conducted with the core epidemiology staff because they were the ones responsible for the onboarding, training, and then managing of these different staffing groups. So we recorded interviews with them, transcribed them, and then we conducted qualitative analysis of those transcriptions, and they were then coded, and we did inductive and deductive themes. The analysis found that the preferred staffing group among our core epidemiology staff were those university partners and the state level hires. Additionally, some ideal employee characteristics emerged. Communication skills were huge. So was public health knowledge, where one interviewee said, "I think that it can be helpful to have an epidemiology background in public health where you have some level of understanding of, stuff like infectious periods, incubation period, and those concepts in your head already." Someone also mentioned flexibility as a key characteristic, and an example of this was that the person is typically very flexible with whatever work needs to be done. They're ready to do what they need to do, whatever task might be at hand, and they're excited to learn something new. Another characteristic was professionalism, and one of the interviews said, "A willingness to learn, someone who has integrity, honesty, like Be honest about your cases. Make sure you're asking the questions, you're writing your notes. Those things are important. And finally, the last characteristic was following official guidance. So based on the collective findings of both the quantitative and qualitative analysis, each staffing group clearly posed different benefits and barriers. Overall, these staffing groups who remained employed for the longer periods of time showed better efficiency and effectiveness. These findings can be used to inform strategies for future hiring during emergency response or other large disease outbreak responses, and can reduce barriers associated with the planning and logistics. Our team really does see some future directions in what we've started here, maybe performing additional informational interviews with members of each of the staffing groups to gain really that employee perspective, and to also perform a deeper analysis of the COVID-19 case and contact data, really to further study the data quality associated with each of the groups. And that is our presentation here. So thank you very much. Please feel free to contact me at the email address or phone number listed here with any comments or questions. Thanks so much.